Disasters come in many forms. But no matter what the disaster might be, your best line of defense is taking the proper steps to prepare before it strikes. If disaster strikes and you don't have a plan, panic can set in, and you and your family will be much more vulnerable. This program will give you the information you need to begin your preparation for an influenza or flu pandemic. At the end of the program, sources for more in-depth information will be listed. You are strongly encouraged to access this information. To begin, what is the flu? Influenza, also called the flu, is a viral infection that attacks your respiratory system, your nose, throat, and lungs. The flu can make you extremely ill, and in some cases, complications from the flu can even kill you. Typical symptoms include chills, aches, fever, congestion, cough, and extreme fatigue. More severe cases can cause vomiting, diarrhea, serious respiratory problems, high fever, and the need for hospitalization. How dangerous is the average flu season?
Each year in this country alone, more than 200,000 people are hospitalized for respiratory and heart conditions associated with seasonal flu. In just a typical influenza season, tens of thousands of people die from related complications, and we're not even talking about a pandemic situation.
What is a pandemic?
Flu strains are unpredictable. A flu pandemic occurs when a new flu virus emerges for which there is little or no immunity in the human population. The virus causes serious illness, spreads from person to person worldwide, and very large numbers of people are affected.
Multiple choice question number 1. 4 major pandemics occurred in the past 100 years. How many people died worldwide as a result of these 4 pandemics? A. 25,000 to 50,000. B. 200,000 to 500,000. C. 5 million to 10 million. D. 50 million to 100 million. The correct answer is D. 50 million to 100 million people died.
The prospect of a next flu pandemic is a very serious matter, and it will happen. It's just a matter of time, so it's important to be prepared.
Multiple choice question number 2. The CDC now recommends seasonal flu shots for all Americans: A. Under the age of 6 and over 65. B. Under the age of 12 and over 65. C. Over the age of 6 months. D. Over the age of 50. The correct answer is C. Everyone over the age of 6 months.
Recently, the CDC revised their findings and now recommend flu shots for all Americans over the age of 6 months. Each year, the flu virus changes, so it's important to get a flu shot every year, and flu shots are typically available starting in September. If you're hesitant to get a flu shot, it's important to know that, contrary to what some people believe, you cannot catch the flu from a flu shot.
Multiple choice question number 3. Those at highest risk to get the flu are: A. People of a certain age. B. People with weakened or suppressed immune systems. C. People with chronic illnesses. D. Pregnant women. E. All of the above. The correct answer is E. All of the above.
Typically, the age groups most at risk for seasonal flu are young children and those over 65. However, in 2009, the H1N1 pandemic flu virus seemed to be most common in teenagers and young adults. That was likely because a similar strain of flu was prevalent in the 1950s, and many Americans who were exposed to it back then developed some degree of immunity.
Here are the top 5 ways to help prevent or control the spread of the flu. 1. Get vaccinated when available. 2. Wash your hands often. 3. Sneeze and cough into your elbow and cover your mouth and nose completely. 4. Avoid crowds when possible. And 5. If you have flu symptoms, stay home and avoid contact with healthy people until the contagious period has passed.
Multiple choice question number 4. What's the minimum amount of time you should wash your hands to effectively remove most germs? A. 10 seconds. B. 15 seconds. C. 20 seconds. D. 30 seconds. The correct answer is C. 20 seconds.
A good rule to follow is to wash your hands for at least 20 seconds, or the length of time it takes to sing the song Happy Birthday twice. When soap and water are not readily available, you should use a hand sanitizer and avoid touching your face as much as possible.
To prepare for a pandemic, make a plan for you and your family. Check with your local health department to see if they can provide assistance. Speak with your children ahead of time and speak at their level. Don't overwhelm them with details. Instruct them to cover coughs and sneezes with tissue and then to throw the tissue away. Further, tell them to wash hands often and also not to touch their eyes, nose, or mouth. Find out if your employer has a plan should a pandemic occur, and depending on your job, if it would be possible for you to work from home. If you have school-aged children, contact the school to see if they have a plan so you can prepare accordingly. Stock up on essential items.
We know that just word of an approaching snowstorm can cause a run on food. During a flu emergency, fewer people may be working at supermarkets and key foods may be in short supply. In general, we recommend that everyone always be prepared for all types of public health emergencies and natural disasters. So, to protect your family, always stock up on essential, non-perishable food, water, personal items, and medical supplies. Canned foods in particular are a good choice. It's also important to have an updated supply of prescription medications. Public transportation may also be disrupted, so plan ahead for alternate routes and means of transportation.
For each person in your family, have a record of key personal medical information that includes medications, allergies, and doctors' phone numbers. Keep this information readily available for emergency personnel. Learn in advance what you need to know to care for someone who gets the flu or who has a related medical problem. Plan what to do if medical facilities are not available or have reached capacity.
It's important to remember that during a pandemic or any serious widespread emergency, outside assistance may take time. That's why you should be prepared to deal with an emergency on your own until help is available.
If a pandemic occurs, gather information on a regular basis from reliable sources, such as the Centers for Disease Control and Prevention, also known as the CDC, and your local or state health department. Keep your strength up, eat right, and get sleep. Remember to cover your sneezes and coughs and wash your hands frequently. Staying strong and healthy is important, especially in times of crisis. Communicate with your children. Encourage them to ask questions and keep your answers as age-appropriate as possible. Don't sound over-alarmed and keep schedules as normal as possible. Regularly monitor your health during a pandemic and be aware of anyone who shows symptoms. Take temperatures often and treat symptoms early.
Many contagious diseases, including the flu, can be spread even before the infected person shows any symptoms. That's why we encourage everyone to always practice good personal hygiene, including washing your hands often, covering coughs and sneezes, and getting a flu shot every year.
It's easy to avoid planning for the next influenza pandemic, but it's not the smart thing to do if you care about your health and the health of your family. Plan ahead and be prepared. You'll be very glad you did.